Hello, I'm Paul Baylis. I'm one of the consultants in Alton Emergency Department, and I wanted to get a message out there that our numbers are increasing again, and maybe that there's a feeling that out in the community that COVID's over. Certainly that's what the government seems to be telling us, but actually the reality is for the NHS it's not over by a long shot yet. Good news is that Omicron's been much less of a severe variant of COVID-19, much less sick people, much less people needing to come to emergency, which has been great. But the reality is here in the hospital, we do have a lot of elderly people, with a lot of sick people, with a lot of frail and immunocompromised people. So here in the hospital, we need to maintain our vigilance against COVID just as much as we did at the peak of the pandemic. So what's my messages to you guys? Well, if you're coming up to the emergency department, please, the message is if you think you've got an emergency, you're welcome. And we don't want people at home with chest pain or maybe strokes or serious injuries that they're not coming up and getting checked out and getting looked after. But if it is a more minor problem, you should really ask yourself, is it an emergency? Can I perhaps look after myself? Can I perhaps get my GP to help out, or the local pharmacist, and avoid attending A&E at this time, because we are under extreme pressure. The wider message for people visiting the hospital site is that unfortunately COVID, well, it hasn't gone away, and we have to, for people visiting the site, they need to maintain their hand hygiene, they need to keep the masks on, and also they need to be socially distancing. And the final message is, if it's possible for you to help an elderly relative to get home from hospital, to help with their convalescence at home, that will be a fantastic bonus, not just for your mum, your granny, but also one more patient out of the hospital means I can move one more patient up from A&E. It means we can get someone off the ambulance trolley and get an ambulance back out there to care for people in the community. So even one discharge is a big help to us. I suppose what I'm summary saying is that unfortunately, as yet, COVID is still a major pressure here in the hospitals, and I'd ask you to bear that in mind if you choose to come up to the hospital. Thank you for your understanding.